gun violence interruption, some of our work on all kinds of safety and health issues we are working on, in a large part Commissioner Ellis has led that. To Chief Colbreth and Principal Womack, I want to say thank you for welcoming us today and for all the work that you guys have done over the past couple of years to keep the community safe. I wish I were here to report better circumstances, but unfortunately today we find ourselves yet again crossing a threshold we don't want to cross. Because of the Omicron variant, over the past month, we've seen the number of people testing positive for COVID-19 increase exponentially. In other words, we are in the midst of another COVID-19 tsunami. And this time it truly is a tsunami when it comes to those cases. It's like nothing we've seen before in this pandemic. We've all seen the results of this tsunami of cases firsthand. Teachers, students, parents with the virus. We've seen airlines canceling flights. We've seen businesses having to close earlier because their workers are sick, co-workers out of commission. We all have those stories of people we know. Mercilessly, up until now, this wave had spared us from the sharp increase in hospitalizations that we had seen in the other waves. And that is until now. Because of an increase in the number of folks being hospitalized for COVID-19, today I am raising the county's COVID-19 threat level to level 1, threat level red. It is the highest level. The 14-day average of COVID positive ICU cases is now 18.1%. The positivity rate is 35%, and the cases continue to climb. This level signifies a severe and uncontrolled level of COVID-19 in our community. It's the third time we've elevated the COVID-19 threat level to red. The first time we went to red, it's because we were in many ways helpless. We didn't have vaccines. But now we're at red, unfortunately, because of a lack of action among those who are refusing to get vaccinated and are ending up in our hospitals. Hopefully, and truly, this could be the last time we go to red. We can make that happen. So I don't want it to all be bad news. So much has changed. As treatments continue to become more available, and they're becoming more available, as more people get vaccinated and boosted, we can make this the last time this happens. But for right now, for the sake of our hospitals and for the sake of our workforce, we have to sound the alarm once again. Not only are the hospital beds being consumed by COVID patients, but the workforce is having to miss work because so many of these health workers have the virus themselves. Even if they're not so sick as to be hospitalized, they have to be home. In a couple of hospitals, I've heard up to 10% of the staff is out with COVID. And so what does this mean for you? What does this mean for the community? The solution to keeping our hospital beds clear for non-COVID patients, for the car accidents, for the pregnant woman that needs to give birth, for the appendicitis case, the stroke, the heart attack, the solution to that is to get the vaccine and get the booster. Do that now so that you help people who may find themselves in need of a hospital bed. The solution to so many workers around our county, including hospital staff, getting ill and missing work, is to take common sense measures to contain the spread of the virus, even if you're vaccinated. Residents experiencing symptoms, COVID-like symptoms, should get tested and avoid contact with others, assuming they have COVID, until they confirm otherwise. Any gatherings should be held outdoors, ideally with masking, as much as is possible. Unvaccinated residents should avoid all gatherings and get vaccinated immediately. You can visit Ready Harris to find a place for a test or to get vaccinated. I want you guys to know Harris County is doing its part to help alleviate the impact from this latest wave. I know parents with students in school in particular are very stressed. Many have been frustrated by a lack of rapid testing availability. So last week we approved an effort with support from Commissioner Ellis and Commissioner Garcia to deliver 110,000 tests to school districts across Harris County. We are also working with CETRAC, our Regional Advisory Committee, to fill gaps, to provide tests. PCR tests continue to be widely available throughout the county, and they're the gold standard. But I know that it takes up to 48 hours or more to get the results back, so that sometimes that can be difficult. But we do have over 10 Harris County public health sites with these PCR tests. So in providing rapid antigen tests to schools, it's another source of information for parents. It helps kids who are contacts of cases be able to return quickly by getting a test quickly, a result quickly, after we know that they're asymptomatic and they've tested negative for the virus. It helps our teachers as well. It simply helps us return to life as usual more and more. Here in Spring ISD, the school district will be receiving 2,250 of the tests we're delivering, and I am so grateful for their participation in this effort. We are also here to announce a new testing site for Harris County. Thanks to the partnership with Spring ISD, starting tomorrow we are opening another testing site at Planet Ford Stadium. It'll be able to accommodate 300 PCR tests each day, and it'll be open for at least the next 2 weeks until a FEMA site opens up also in the same area that will have even more capacity, we hope. Registration for this Planet Ford Stadium will be available starting at 4 p.m. today at readyharris.org. And as I said, it's only one of over 10 Harris County public health sites throughout the county offering thousands of tests every day. I can't be in this beautiful library and not take a moment to thank our teachers, to thank our staff, to thank these incredible frontline workers that have had some of the toughest jobs throughout the pandemic. So I want to acknowledge them and remind everybody that anything we can do to alleviate the stress on these incredible frontline workers and alleviate the stress on our parents, on our families that are facing so many challenges as the kids return from winter break, that we should do this. And I want to thank Spring ISD again for their leadership since day one. They have been following the public health guidelines. They were some of the very first ones out there with masking, and that has shown in the results they've had, and really bringing the community together. As with the start of the virus, this is a community issue, and it's an issue that we solve together as community. And I hope that all of us can continue to work together to make it through. I'll repeat very briefly in Spanish. Le quería agradecer a la directora Womack de aquí, de la primaria, Booker, también al jefe de policía, Ken Culbris, y al comisionado Ellis. Me gustaría estar aquí para reportar mejores circunstancias, pero desafortunadamente estamos cruzando nuevamente un umbral que no nos gusta cruzar. La variante Omicron del COVID-19 ha realmente explotado en esta comunidad como lo ha hecho en muchas otras comunidades. Estamos viendo esencialmente un tsunami de casos que ha impactado a todo el condado. Hemos visto el impacto, vuelos cancelados, negocios sin trabajadores, trabajadores en nuestros propios sitios de trabajo que no han podido continuar con su desempeño por causa del virus. Hasta ahora, sin embargo, hemos evitado lo peor de este tsunami con limitadas hospitalizaciones por la ola de Omicron. Lastimosamente, ya entramos nuevamente a un incremento en hospitalizaciones. Dado a un incremento de personas hospitalizadas por COVID-19, hoy estoy elevando el nivel de amenaza de COVID-19 del condado Harris al nivel 1, nivel rojo. La tasa de positividad está a 35%, La población en las UCIs que tiene COVID-19 está sobre el 18%. Este nivel rojo significa un nivel descontrolado de transmisión de COVID-19, un nivel severo de transmisión de COVID-19. Es la tercera vez que hemos elevado nuestro sistema al nivel rojo. La primera vez que fuimos a rojo, en algún sentido, pues estábamos indefensos, no teníamos vacunas, no había tratamientos. Hoy día es diferente. Está en nuestras manos el que esta sea la última vez que vamos a nivel rojo, porque ya hay vacunas. Pero estamos lastimosamente nuevamente en rojo por aquellas personas que se rehúsan y se niegan a recibir la vacuna. Espero que esta sea la última vez, con tratamientos que se están volviendo más y más accesibles, con personas más y más vacunándose y poniéndose el refuerzo. Pero nuevamente se están consumiendo nuestras camas hospitalarias por casos de COVID y eso está impactando a la comunidad en general. Además, no solo son las camas hospitalarias, hay también trabajadores de hospital que no están pudiendo trabajar porque tienen el virus. Hay ciertos hospitales donde hasta el 10% de los trabajadores hospitalarios están fuera con COVID. ¿Qué significa para ustedes? La solución para mantener el número de camas hospitalarias abiertas, para los derrames, para las mujeres dando a luz, para los accidentes de carro, es que se vacunen y que se pongan el refuerzo. La manera de controlar tantas personas con este virus que están enfermas y no pueden trabajar son medidas de sentido común: utilizar la mascarilla, hacerse la prueba. Estas son las recomendaciones. Si tiene síntomas de COVID-19, hágase la prueba y evite el contacto con otros, asuma que tiene el virus hasta que sepa lo contrario. Cualquier reunión, hasta donde sea posible, de llevarse a cabo afuera y ojalá con mascarillas. Personas sin vacuna deben evitar cualquier reunión y vacunarse inmediatamente. Puede visitar readyharris.org para hacerse una prueba o para recibir su vacuna. Estamos poniendo de nuestra parte también para aliviar esta última ola de casos. Específicamente, hemos aprobado la compra de 110,000 pruebas rápidas para distribuir a nuestras escuelas. Hoy día le estamos distribuyendo 2,250 pruebas a esta primaria Booker para que puedan así los niños regresar a estudiar, los niños que no tienen síntomas pero que han estado en contacto con otro niño con COVID. Seguimos teniendo las pruebas PCR en las sedes de vacunación, en las sedes de prueba del condado Harris, y hay más de 10 sedes de prueba, pero pues yo sé que estas tardan 48 horas. También vamos a anunciar una nueva sede de prueba para el condado Harris. Empezando el día de mañana, abrimos una sede en el Planet Ford, en el estadio Planet Ford, aquí en Spring. Se pueden empezar a registrar hoy día a las 4 de la tarde y tenemos más de 10 sedes, miles de pruebas diarias PCR a las cuales se puede registrar en readyharris.org. Quiero agradecerle a los maestros estando aquí en esta escuela tan hermosa. Quiero agradecerle a todos los trabajadores escolares por el sacrificio que han hecho, y sé que ahora que regresan los chicos a la escuela es muchísima la ansiedad, el estrés que tienen los padres con tantos niños enfermándose. Entonces ayudémonos los unos a los otros, poniéndonos las pruebas, poniendo las vacunas, haciendo las pruebas, utilizando la mascarilla. Ya esto va para mejor, pero hoy día la situación está difícil nuevamente y eso, el controlar eso está, como ya sabemos, en nuestras manos. We'll hear from Commissioner Ellis and then from the Chief.
Judge, thank you for your leadership. I was just thinking as you were speaking, this is one of the few press conferences I've been to with you where everybody keeps their mask on. And from time to time, even I have taken my mask off. Omicron has me nervous. I will keep the mask on today. I want to commend you, Judge Hidalgo, for your leadership. It's certainly a tough job that you have. And throughout this process, you've always focused on what is good policy. You're not focused on what the poll data was saying or what politics would indicate that you ought to do. And I think we ought to commend you for that. I'm glad to be here with the principal. I was telling Principal Womack, under your leadership, it's been a new day. Not only have we given this school district money for computers, for hotspots, now we're giving you testing materials, rapid test kits for kids. And we're also encouraging you, and we're going to put some county money up to encourage you to do disparity studies so you can set up programs so your great students, principal, can not only get educated here, but can go on to build schools like this. But look, it's important. I welcome you to a part of my precinct in redistricting. Obviously, I'm going to take in a bit more of this area. We're going to do sidewalks. We're improving Bammel Road and other things in this area. This is an important community. And Chief, we're certainly doing as much as we can do to help with the issue of violence, which is prevalent throughout our county, and in some ways, I can't help but think that this pandemic plays a role in that as well. So Judge, thank you for your leadership, and with that, I neglected to mention that Erica Brown, I hadn't seen her in person when she had the mask on. I've only seen her on Zoom. It's good to be with you, of course, and with that, I bring up Chief Ken Colbert.
Mr. Harris, thank you. Chief Ken Colbert, as also the representative of the district today, and as our leader of our emergency management team, I want to say first thank you, Judge Hidalgo, for your leadership, Commissioner Ellis, and our partnership we've had with Harris County since the beginning of the pandemic. It's also my pleasure today to take an opportunity to say that we will take these 2,000 kids, we will put them into our schools to try and support our families as best as possible. We're continuing to work through that process, and tomorrow, Judge mentioned that we have a site that's opening up with another partnership, extended partnership with Harris County at Planet Ford, so just another opportunity for us to support our campuses and our community. Since the beginning of the pandemic, we've also partnered with another private vendor who we also have at 2 other sites. So we will continue those partnerships and do everything we can to continue to provide a service to our kids to keep them in school learning. In addition to these measures that we're putting in place, we're also asking that our staff and students continue to practice the processes that we have in place and the procedures of masking, of keeping the hygiene levels to the levels that we currently have them, and following all protocols. If you're sick, please stay home. And these tests give us another opportunity and another tool that if you feel ill or you were exposed in close contact, you have another tool to make sure that you're starting the process to go get a PCR test. And again, I want to thank Commissioner, also Harris County. Thank you so much. You and I have been on several calls together, and your leadership has been paramount to this move as well. And Judge Hidalgo, thank you.
Thank you. Thank you so much. We'll take questions.
Judge, what's your view on the events coming up, obviously, with the marathon this weekend, MLK parade, and rodeo in a couple weeks?
Yeah, we're taking it as it goes. The situation right now is very, very volatile. We need to see where the cases will go. We need to see where the hospitalizations will go. As far as the marathon, I know that Dr. Peirce personally signed off on the marathon plans. He's the local health authority for the Houston Health Department, and so I had the Harris County Public Health Department consult with them and confirm that the Houston Health Department had signed off on it. What I'm told is that the marathon is implementing several measures for phased starts, keeping people out of indoor settings, not passing out food in the same way in indoor settings, etc. As far as the rodeo, it is something that it's hard for me to speak on right now, knowing that it is still well over a month away, the start of the rodeo. And so we'll see if by then the cases, and especially the hospitalizations, are trending down. I hope so, because if there's one thing that I hope we can celebrate as before, it's the rodeos where it all started. So that's another impetus for us to all do our part. The guiding principle here is there's a big difference between indoor events and outdoor events. Events where there's mass outdoors, even better. So to the extent that that can happen, and that people who go are vaccinated, that's the kind of thing that at this stage, with the vaccine being available, that we can feel more comfortable with.
Judge, at this point, the growth rate of Harris County's vaccination rate is very slow, to the point that at this rate we wouldn't get to 70% until about July. What, if anything, can Harris County do to boost that rate, and why do you think it's so slow at this point?
We've done everything we can, right? From sending more vaccination sites to areas with lower vaccination rates at the start, prioritizing the areas that most need the vaccinations because they're harder for them to access it, partnering with community groups that have the ear of the community to try to get people there. We did our incentive program. We've partnered with schools on several different initiatives. You know, the one other thing that we could come up with, unfortunately, became politicized and fell apart. So, you know, that was the other thing that we had come up with. I'm constantly challenging my public health team to come up with something new. And the truth of the matter is, we've tried it all except for, you know, this other thing. So I need to appeal to the community. The most powerful message is you. If you know somebody who doesn't have the vaccine, if it's a friend, if it's a colleague, if it's a family member, if you tell them that you got it, you're just fine, still standing, you're feeling healthy, that will go a long way. That will help a lot. A lot of, or whatever polling data exists, says that it's a person-to-person message. And look, we're going to continue partnering with the schools. That's where we have the lowest vaccination rate, is particularly on the kids. And so we're going to keep working on that and doing everything we can come up with. But that's why we're here. Those folks taking up the hospital beds, they are the folks who are not vaccinated. And of course, there are some folks there as well who are immunocompromised. But a big portion of it is the folks who simply are refusing to get the vaccine. So this is another reminder, we're not giving up. That's why we're here today, and we continue with our efforts. But there's only so much that we can do. We've tried it all.
Josh, can you, the mayor spoke a little bit about how many city employees, firefighters, police officers are out. He mentioned that they might not be able to get to as many, like a trash pickup in the city for the same day it's scheduled and things like that.
These specific statistics as to what folks are out, but we have a lot of people out. I'll say my own staff, there are people who are out, and the reminder there is, you know, the mask. The mask makes a big difference. If you have to go to work, and only having the people in person who really need to be in person.